So I now want to not only introduce Liz, who's going to be on the panel, but also Breed O'Brien. Breed, good morning. And
good morning.
Also, who is the Deputy Director for Digital Health with NHSX. Welcome, Breed. And secondly, Professor George Crooks, OBE, Chief Executive Officer at Digital Health and Care and Institute, who I'm delighted to say is also a board member of Tech Quality. So good morning, George.
Morning.
What I'd like to do is to ask you each the following question to start with. What are the key things you have learnt, and what are your key insights that you can take forward after this first phase of the pandemic? So, Bree, could I come to you first?
Yes, yeah, delighted. Thank you, and thanks for the invite to join the panel. Just for background, the context of anything I say is as someone who works with technology, I come at it from an improvement science perspective, so I'm always talking about people, process, and technology in that order. So just want to really reiterate that. And for me, and it's been fascinating listening to the presentations this morning, I think I'd have to start and agree wholeheartedly with Caroline. In over 30 years in healthcare, many of which are working in improvement in technology, I have never seen the common sense of purpose that we've had. And I think I've never seen such joined up thinking and working. So to me, that's been incredibly valuable, and we need to think about how we harness and retain that. Equally, picking up, it's interesting how you think about how you might respond to some questions like this. I feel I'm going to reiterate what people have said, but that's not a bad thing. Jane mentioned about, how people more joined up thinking, and I've observed a language change. I observed GPs talking about my care home. This partnership working. It's a really, really strong and obvious change, and again, hope we can continue to work on that. I think pragmatism has overcome bureaucracy in many cases, and that's been huge. We've had really positive feedback on simplifying our IG guidance early on in COVID. That's been really well utilised and really well received. And I hear examples of pragmatism versus bureaucracy across the system. And then I think the technology, we've had people, because of the common sense of purpose and the need to deliver care in a different way, technology and people embracing it has moved in a way I have never seen before. And we've moved from the concept of not invented here, which has been rife certainly in healthcare, and I presume in care, in the health sector, and I have to presume in the care sector as well, that because we didn't invent it, we don't want to embrace it. But what I've seen is people saying, tell me what you're doing, I want to do it, and I want to do it better, but I will learn from you rather than duplicate. So that has been, we've moved, I think, leaps and bounds because of this, responding to a crisis, but this joined up working, joined up thinking and partnerships. And we've had amazing support as well from the tech sector through from the programme I lead is called the Regional Scale Programme and Innovation Collaborative, which is to rapidly scale remote monitoring across the country in England, and people have touched on the value of that. And we've worked with lots of tech innovators here, and it's been really good partnership working. But it started from a clinician coming to us saying, I've got so many patients with COVID, I can't manage them. Have you got a tech solution? And we matched that to a pro bono offer from an innovator, and actually they still work together. And that has led to us creating this program and lots of other organisations and lots of other tech innovators working together. And we now have, I think Tim said we had 87 organisations using COVID oximetry at home and COVID virtual ward by using tech enablement, but we've now got 91. So it's a fast-paced progress. But in my career, I've never seen such common sense of purpose, such joined up thinking, and a willingness and a pull for tech. So I think we've really moved to a different place, and the question is how we can capitalise and keep that going.
Thank you very much, Breed. Very interesting. And so now if I move on to George, to ask him the same question, what are the key things you have learnt, George, and what are your key insights that you would take forward post-pandemic? Thank you.
Thanks, David. I mean, there are a number of things from me. I mean, first of all, I think we're all kind of violently agreeing here, which is no bad thing, but let's kind of just throw one or two challenges in. I mean, for me, the key learning is that it doesn't matter how clear, or maybe not so clear, government policy statements have been, it actually doesn't really matter how much you legislate and enshrine in law and what you expect people to do, that how this virus has impacted on individuals, on communities and the country generally has been down to the individual behaviour of people. And it's that focus that actually is very important here. And it's very important in any discussion when we talk about enabling technologies and digital tools and services. It's all about the citizens, the patient, the service user, their family. And that's important for us because the one risk we potentially are facing is that technology has become ubiquitous in our day-to-day lives. And I'm talking about how we run our social lives, how you do your shopping, etc., etc. And it is becoming ubiquitous also in the delivery of health and care. But what we don't want to do, and the one thing we can't afford to do, is simply to layer technology solutions on top of the standard way we deliver services and think we're doing a good job. And when we were talking earlier this morning about home care, that's a perfect example. How do we use digital technologies to empower the citizen and their family to make better health and well-being choices, to allow them to be better connected to their communities, to allow them to actively participate in their communities, and to deliver more of their own health and care? But equally importantly, how do we use these technologies to support those delivering care to actually feel safer, better supported, and more secure in making the decisions that they are making on a day-to-day basis for their clients, to act in their best interests and to advocate for them? And equally importantly, how does that data move to inform those who are making management choices, be it in the health sphere or the social care side or in service planning? So for me, that's the bit we need to sort out and get our head around. Because unless we empower citizens to actually do these things, be more preventative and proactive in their thinking and delivering more of their own services, the demand and capacity challenges that we're experiencing today, and we know are only going to get worse over the coming weeks, months and years, are really going to cause major, major problems.
Thank you very much, George. Yeah, definitely some interesting thoughts there about the challenges, the challenge to us about how this works. And we often think, don't we, about what can government do for us? What's the government role in this? And actually, you're absolutely spot on. This is, if anything, demonstrates more powerfully that it's about the interrelationship between government does and what individuals do and everything else and all the organisations in between. Nothing has demonstrated this more. Liz, we've heard from you this morning already about your insights about how we move this forward, and I just wondered whether you wanted to add anything briefly to what you've already said. But also, there's one particular question we've got here from Rachel Forbister, which says the barriers to adoption have been highlighted. Have you any advice to leaders in how to overcome these barriers? And I thought of you because you gave us such a practical exposition of what people might need to do. So I thought you'd be an ideal candidate for that question.
Yeah, absolutely. I'll take that one first, and then I'll give my 3 points on what we've learned and must take forward. So I suppose practically the first thing is do something. the digital health revolution is here. If you're going to do something, start with trust. Make sure that if you're going to try and get high quality products to people, patients, clients, you must do that in a safe way, because unfortunately trust is hard earned, but it's lost very quickly. So we must start with trust. You then need a connected strategy. Who is it you're going to target first? Of course, digital health can benefit everybody, but unfortunately, that isn't how change happens. We have to start with a lens, start with a problem that you want to solve, and also measure the impact, because in measuring the impact, you can then prove the success that you've had, and that's how you'll scale it. The question about what we've learned, however, also is pretty relevant. So I have three things. The first is technology won't fix everything. I think Breed was touching on this really. Throwing technology at a problem isn't the solution. We have to think about, as Breed said, people and processes, and it does start with people. And that's about embracing our workforce to be able to know more and feel comfortable in this world, and then helping them to know at what point do we need to put these interventions in. The second thing, which George was really touching on, is collaboration is king. That's collaboration across private and public sector. But we also need to learn from each other. There are lots, the whole world is going through this revolution, and we can learn from each other and really benefit from the lessons learned. And then the third thing is, we're not going back, are we? The genie's out the bottle. I was talking to some colleagues last night in New Zealand, and they only had a very brief interlude of lockdown, but digital health has been maintained. So this is the way forward, and we need to embrace it.
Thank you very much, Liz. So I'd now like to move us on to, so we've talked about some of the things we've learned, the key insights, key challenges. I want to move on now to what are the key drivers for change, and what would you give as the call to action to the tech sector to deliver this? And in that context, we've had a question from Karen McCormick, which is, how do willing co-producers, carers, users perspective who have tech solutions for well-being get talking to the right people to go work together with us to develop solution? Is there a framework or program that can be delivered around this to help us bring forward those ideas? So it's the whole thing about in this space, co-production in order to deliver the outcomes that people want in a way that suits them. And so I'll come back to Breed to kick us off on the whole issue of the drivers for change. And if you could sort of think about Karen's question as you're doing that, Breed, that would be very, very helpful. Thank you.
Happy to. I do feel we are going to be consensus, because George, what you think are challenges, I think are just such inherent components of what we're all trying to do. I think, and building on what Liz just said, I think patients and staff expectations have changed forever. As you say, the genie's out of the bottle, and we need to think about, people are not going to revert back to having to travel a couple of hours to get a GP appointment when they could do it from their desk and work or things like that. So I think the expectations have changed. Equally, I don't think we've got a choice. I think if we're going to recover from what, we've had this pandemic, we have a huge backlog. We have to think about how we can do things differently. And supporting George's point, this is not about putting technology into existing ways of working. This is really rethinking and our ambition about how we might do things and how technology can support that. But equally ensuring that the patient voice is at the centre of all this. And our programme is called Supporting People at Home for a reason, which is we want to enable the self-care model, but in a supported environment. So that could be through remote monitoring tools, people knowing. We've had a wonderful quote from a patient who was looked after in a COVID virtual ward, saying the reassurance his family got, knowing that somebody was watching what was being fed into the system, so he could relax and not worry at a really challenging time. And I think that's really important. Without a doubt, our ageing population and long-term condition management, it's a real opportunity to enable this real partnership, not just empowerment, but partnership working with our patients and citizens. And we need the social care, people accessing social care, huge numbers, large staff group, a focus on how technology could support them, because it's clear to me that there's huge disparity. We've got some people we talk to who in care home sector, want to look at AI. They are so far advanced, and others who can't get a basic connection or have got no NHS email. So rebalancing that, and there's lots of work going on with the care record and NHS mail and connectivity. Equally, our workforce is going to have to change. So we know we're going to have a really big challenge. We'll have lots of data, but actually data remains data unless we can gain the insights from it. So our data analytics, helping really to move that data to knowledge, to insights, I think is a key driver for us, because otherwise we won't use it to improve services. And then I think always being aware of inclusivity, because there is a risk, as I think George alluded to, that this could exclude some people. So we really need to always ensure there is a non-technology option. But by ensuring the people who can use technology do, we've then got more time for those who can't. And I've heard that from GPs, from other people, that actually it is making a difference. We talk about it being digital exclusion. I'd like to think about it as inclusive, but actually also balancing who needs what, and coming back to something I think Tim or somebody said about personalised care and patient lived experience. And picking up the question, personally I think co-production has to happen at a more local level. It has to be around local teams. It has to be around, we can obviously do co-production at the centre in terms of strategy and what's important, but actually really getting that into action needs to also be locally owned. So I'm not sure whether the question was based on what can we do at the centre or what needs to happen locally, but we've had really good examples in our remote monitoring work in the North East, working with an organisation called mHabitat, where they're really driving inclusivity and co-production, and I think the two go hand in hand. So if I'm really happy to connect people if that's helpful, but there's so many variations to that theme, but others may have another view.
Sure. So thank you, Breed. And George, the key drive for change and about putting the people who use services at the centre, and I know from discussions we have had how passionately you feel about putting citizens at the centre of this and controlling their own records, for example. But I won't steal your thunder. I'll just reflect it on that comment. George.
Yes, I am kind of certainly. I'm beginning to lose friends because I climb onto the high horse all the time. I'll try to avoid that today, David. But I want to kind of just set in context our reality, because I think most of us who are sitting within the system have got a degree of insight what's over the hill, but a lot of people really don't. And one of the key things that was pointed out to me just the other week was that, and I'll just talk from a Scottish perspective because I'm based up here, but we're 10% of the UK population, and it really is transferable. That in 2020 there were over 500,000 less contacts made by citizens with health and care services than there were the year before, and about 155,000 or so less hospital admissions. That's at a time where the burden of underlying disease, and I'm not talking about COVID, let's take COVID out of this conversation, where the burden of underlying disease has not changed one iota. Therefore, what we know is that within the health and care services within the UK, we have got waiting lists at levels that are higher than they've been for many, many years, and no organisation meeting its waiting time targets, and I'm not blaming anyone for that. That is completely understandable. But we are also sitting with a huge amount of disease burden out in the community that haven't yet knocked on the door of formal public health and care services, either making do themselves or slowly deteriorating and not wanting to trouble the system. That is not going to stay like that forever. It is going to change, and we've got to work out how we're going to rise to those challenges. And that means engaging with citizens now to make sure that those who require assistance know how to get it. But equally importantly, we are facing that challenge at a time where the workforce across health and social care is very tired. And we keep hearing about we need to decompress is a word I've heard. I don't like the word at all. Or give the workforce a rest. Now, I don't know how we do that because I sit in high-level meetings and I have done for many years. I was a medical director for over 20 years. And the way the health and care system responds to challenges like that is you work your assets more. You run clinics in the evening, you do surgery lists on the weekends and so on and so forth. That's not an option going forward. So we need, just to go back to Breed's point, we need to transform how we're delivering services. And that is putting the person at the heart of everything we do, focusing on user-centered design. Let's talk about what the system expects to deliver, but what does the citizen expect? What is a positive outcome that an individual is looking for? And it might not be a blood test result. It might not be the time to being seen. It's, can I manage to get to the corner shop to buy a newspaper, either on my own or with support? Can I meet my friends for a cup of tea or a cup of coffee and have a laugh and a joke with them? So it's not the kind of metrics that you and I as health and care professionals are used to. And so we need to engage citizens in a different conversation. And going back to what Liz said in her presentation, make them aware of all the tools and services that are out there that can provide support. Don't make choices on people's behalf.
Thank you very much, George. Yeah, absolutely right. Really thoughtful and stimulating. So, Liz, your thoughts on what are the key drivers for change? And from the auditorium, we've also had, in that context, a question about how do we prepare our workforce for digital as part of the norm? So somebody who's been heavily engaged in this space, any top tips for people about how we do that? But in the context of what are the key drivers for change and what's your call to action? You're muted.
Apologies, somebody's got to do it and it had to be me. And what I was going to say there was, yeah, of course, David, very happy to respond to that. George and Breed, completely agree with everything you've said, and I don't want to duplicate comments. But on the point that you were talking about there around how do we support the workforce, actually what I was going to say on the drivers is there's a real push and pull at the minute. And what I mean by that is there's a real push from policy and direction to say we should be using digital in our care and in our support around healthcare needs. And that's the push, but there's a huge amount of pull from patients and citizens. So I touched on the fact that 5 million people every day are actively trying to seek a health app. We have now more smartphones on the planet than we do have toilets and toothbrushes. Not a great public health message, but it is a reality. And so we have this real push as well. And to George's practical point, if you're a health or care professional currently and you're sat in clinic to see a patient either remotely or face to face, patients are now walking in with their phone and saying, I'm using this tool. That's quite scary if you're that clinician, because we haven't been trained in these tools and we have to go back to workforce development. And I know that there's been some amazing work happening, particularly in supporting the champions of the system. I think where we need to move to, and where we are starting to move to, is actually supporting the broader health and care professional network and embedding the workforce transformation pre-qualification. We must embed these tools in the same way that we wouldn't ask a doctor to prescribe a drug without relevant training. We can't really be asking them to now start prescribing or recommending digital health interventions. So the workforce transformation has to start very, very early. It has to start pre-qualification, but also for our current workforce, we have to embed this into mandatory training and induction. We can't just think about the champions, because if we're only thinking about the champions, you actually get a real challenging situation where you have the extremely activated people going back to an organisation that hasn't got the same level of readiness. And so we have to address both ends of the spectrum. So the drivers are, very well rehearsed, obviously, through Breed and George. But for me, there's this real push and pull, and it's coming from us as people and patients, and it's also coming from the system. And as I said before, we're not going back. So my call to action is let's start to embrace it.
Thank you very much indeed, Liz. So it's what a great place to sort of finish this, more or less. But there is one quick question I wanted to ask each of you, just for a quick point, really, which is, if we're sat here in a year's time, or possibly even not just virtually, actually in reality together, as good as this is, what would your hopes, each of your hopes, be about what we'll have done to move on this agenda? And I'm sorry to land this on you, but I thought we could just finish with and I'll give you a bit of a moment to think about it. I can see Breed thinking, looking up at the sky and thinking about what she would hope for. So yeah, what would it be? What if there was one thing we'd move the dial on, that we'd made a difference? We'd actually come together, we'd kind of picked up all your drivers for change. What will have happened? So who wants to go first? George, can I pick on you?
Okay, what would I like to see? I would like to see us being, and this is going to sound really kind of nerdy, I would like to see us in a position where we can blend data collected by the individual person themselves being aggregated with formal health and care data, so that we can get a true understanding of the lived experience of individuals and base our ongoing care management, our interventions, and our service planning based on the lived experience of individuals, not simply on the 16% of available data that we do at the moment. And that's the data that the system trusts, and that's the data the system generates itself at the moment. So that, for me, would be a major plus.
Fantastic, George. So it's data based around the needs of individuals in a much more comprehensive way than we've got now. Brilliant. Breed, well, how did you get inspiration from looking at the ceiling?
Well, perhaps I completely agree with what George said, because I would really like to be able to say in a year's time we are seeing outcomes, on the impact on healthcare from actually supporting and enabling patients to be real partners in their care. And we can't do that without the aggregated data. But actually, both the user, the lived experience, the sort of patient story supported by the data, that we were really able to demonstrate that.
Fantastic, Breed. And last but by no means least, Liz, give us.
I'm going to give two, if that's okay.
Oh, I don't know about that. Well, okay.
Always want to push. So yes, I think that my first one, which you probably already heard from a passion perspective, is that workforce transformation, the workforce development. If we can really activate our healthcare professionals to feel comfortable in this new world and embrace it, actually what we're going to do there is be able to activate more communities to be able to utilise the benefit of these tools. And then just to pick up on what George said, my second point is definitely around that data. And actually, yes, of course, as a system, we want to see that data, but actually as a patient, I want to see that data. And I want to be able to see an aggregated view of not just my health data through digital health solutions, but also my clinical data. And I want to be able to hold that data as a patient and then be able to share it as I see fit. So those are my two hopes.
Brilliant. And what a great way to end this morning. So I don't know about all of you who are participating in this morning, but I've thoroughly enjoyed this morning. I've learned a great deal I feel privileged really to have been able to hear the expertise of Caroline Lamb's experience and around her experience in Scotland, when she posed the question, why has it taken a pandemic to move us on from a digital point of view? And I think Breed reflected that we've seen some absolutely remarkable things happen. We've had Tim Strong painting a picture of, I think, optimism about how we will moving in a more systematic way towards community health interventions for the NHS at home. Jane Townsend on doing things differently. Martin Green on the benefits of care records linked to people in care homes, the benefits for the people, the benefits for the care providers, and systematic ways of doing things. And Liz, your very practical exposition of the arrangements with examples. And thank you both also to the panel for your very interesting discussion over the last half an hour or so. It's been very interesting and illuminating, given us a lot of things that we can, I think, go away from this conference on to build a better future.